Pain is one of the more challenging aspects of multiple sclerosis, and it affects every patient differently. But one of the more difficult aspects of MS pain is it's oftentimes very difficult to treat with conventional pain medications. The neuropathic pain that's often what comes with MS doesn't respond well to over-the-counter anti-inflammatory meds or even more aggressive things like opioids in many cases. So it's a real problem, and that creates a lot of suffering for MS patients. And that can lead to not only just pain that you're living with, but mental health issues. There are addiction risks. There's a bunch of problems that can come with it. And as somebody that has dealt with multiple sclerosis for 20 years and multiple sclerosis pain, including trigeminal neuralgia, a very painful aspect of MS that left me unable to speak or eat solid food for 4 months, I've been on a hunt for good pain therapies. And last night, that search led me to the campus of University of Michigan to hear a presentation by Dr. Ann Baker, a researcher with the Center for Chronic Pain and Fatigue Research. The seminar itself was presented by the Student Association for Psychedelic Studies. The SAPS is a really great group of inspiring students that are trying to be part of the solution here and trying to find ways that psychedelics can be used to deal with pain, addiction, mental health, a variety of needs. And so it was quite interesting presentation to hear, and Dr. Baker is extremely knowledgeable on these subjects, so it was really informative. I had some familiarity with psychedelics use for pain and for MS 2 years ago that had led me to ketamine. I made a whole video on that use of ketamine for multiple sclerosis and the research behind it. Dr. Baker's research has taken that to another level and gotten into other issues that I think are really worth exploring. Ketamine has a lot of potential benefits for multiple sclerosis. In addition to the pain relief, it's anti-inflammatory, it's immune modulating, it promotes neuroplasticity, which can help restore functions that have been damaged by MS. So it ticks a lot of boxes in terms of MS therapy and can be really useful. But it's not the only option out there. There are other psychedelics that are coming out like MDMA or magic mushroom, psilocybin, that can be really useful. And in many cases, we're seeing those legalized or decriminalized around the country as governments are starting to recognize the potential medical benefits here. And I think that's going to continue, and we hopefully will see new changes. But Dr. Baker's research is exploring how these things might play out and be useful. So it was quite interesting to hear her perspectives on the applications, whether it was for ketamine, for this being specifically well suited for some of the MS issues like neuropathic pain, but also the use of other psychedelics for dealing with pains of different sorts. And dealing with the mental health and addiction risks that often comes with that. Chronic pain can be a real problem because not only are you suffering with the pain repetitively and having to take medication that can be very addictive for a prolonged period, that right there leads to addiction risks, but also the chronic pain itself intersects with some of the same parts of the brain that deal with addiction and make us more susceptible. So it can be a real threat for MS patients. And so that's why some of these non-addictive therapies can be so intriguing and potentially life-saving as we get further into this. One of the aspects of psychedelic medications that I think are particularly intriguing and appealing is that they are closer to a one-and-done kind of a therapy than almost anything else that I've run across. It's not as if you just take this medication and then just keep blanketing yourself with it for the rest of your life. Through a combination of therapy, whether that be psychotherapy, talk therapy, physical therapy, to build up new connections, new patterns, new associations. The psychedelics really can provide a very long-term or at least long-lasting benefit for the patient, whether it's for pain relief, mental health, addiction recovery. It's really profound. Also, while a psychedelic therapy can involve the kind of stereotypical out-of-body experience that many people associate with the psychedelic experience, there's also very non-psychedelic options that are available that people may not be really aware that they've taken anything, but they're still getting very profound benefit over time. It was a very interesting presentation. Again, I'll leave a link to my prior video on ketamine if you're interested. But keep an eye out for what Dr. Baker and the team are doing. I think there's some really fascinating research and inspiring work ahead there. So I was really glad to be part of that last night. Hope that's helpful to you, and I will look forward to talking to you soon.